Hi, I'm Tim Norton, 2nd District County Commissioner. Welcome to A Word in Edgewise. I've got a very important topic today. I've written about it several times over the years, but Project Access is celebrating their 15th anniversary in our community, and we're so excited with the work that they've done over the years, the amount of voluntary and free care that they've given, and what they do for the community. And with me today is Ann Nelson and John Rosell, and I'm going to let Ann give me her new title because I don't know that I can spit it all out. I know that she's very integral with Project Access, but she's got a new title, and we're very proud of that. So welcome, John and Ann. It's good having you with us today. Well, we're excited that Project Access, 15 years of serving the public with health care needs and specialty care, primary care, and other pharmaceuticals. And it is a public-private partnership, but I'm going to let you explain the history, how much money is volunteered through the medical community, and how this all got started.
Okay. Well, my name is Ann Nelson, and I'm the Executive Director of Central Plains Healthcare Partnership, just to explain that. And if you can say that in one breath, you're having a pretty good day.
Obviously, I couldn't.
We are a nonprofit affiliate of the Medical Society of Sedgwick County, and we did open our doors 15 years ago to start serving the uninsured. Our organization was started by a local cardiothoracic surgeon, Dr. Paul Ulig, was really concerned about the uninsured in Sedgwick County and learned about a program in Asheville, North Carolina, run by the Buncombe County Medical Society. So a whole group of Wichita leaders flew out from Wichita to Asheville, learned about the project there, came back and said if they can do it in Asheville, we can do it in Wichita. And here we are 15 years later. We coordinate donated medical care for medically uninsured low-income members of our community, the vast majority of whom are working people. There are some myths about the uninsured. Just kind of a big picture perspective, there are about 65,000 uninsured adults living in Sedgwick County. That's about 3 times the population of Derby. It would fill the Entrust Arena 4 times. There are a lot of uninsured in our community, some of whom on any given day get ill, get sick, and they have no access point into Project Access or into the medical community. So Project Access does that for them. There are 2 different ways people can get into our program. The first is through some community clinics. There are 3 federally qualified health centers, Grace Med, Hunter, and Center for Health and Wellness, and then other community clinics, Guadalupe and EC Tyree and Mayflower Clinic. And we have a 3-way partnership between Project Access, the community clinics, and the state of Kansas. They have co-located some eligibility staff at those clinics. So if somebody needs specialty care at the clinic site, they just walk down the hall, meet with the DCF eligibility specialist, they get enrolled, and they're in our program. The other mechanism for enrolling people is at the request of physicians and residency clinics that participate. So what is Project Access? It's really a coordinated effort of volunteer providers. We have 625 physicians, 8 hospital systems, 13 dentists, and a wide variety of other providers, optometrists, hospice care providers, physical therapists. So when people access our program, that care is then donated on their behalf. They're enrolled for 6-month periods and see the physician specialists that they need. They have that inpatient and outpatient hospital care donated. They also get a prescription card because we do have a medication program and a medical equipment program with some of our city and county funds. And we have 85 pharmacies that agree to participate in Project Access by not charging any dispensing fees. So somebody can get their prescription filled with a $6 copay. The rest is covered by our program.
Wow. John, I'm going to kind of throw it to you now.
Sure.
This all incubated out of the Medical Society and some doctors, and now, this many years later, 600 physicians come to the plate, and over 15 years have donated millions of dollars worth of care.
We estimate, Tim, that approximately $162 million worth of care has been delivered through Project Access since its inception. It really serves as as a model program in the country for how a community can rally together and help support a very important part of our community, those neighbors of ours who may be uninsured and don't have ready access to health care. We know that when folks are uninsured, they experience illness maybe more often at a more severe level. And our doctors 15 years ago, and a number of other strong community leaders from United Way, as well as the city and the county, really took it upon themselves to organize a program from Buncombe County, North Carolina, to really be able to coordinate care, to be able to allow access to care before it was an emergency, and hopefully be able to prevent care from being delivered in an emergency situation. If we can treat a problem when it's minor, we all benefit. The patient benefits because they can return to work sooner. Our community benefits because we don't have uncompensated care that is delivered in our community, and that puts a drag on all of us. It does serve as a model across the country. We're delighted that we have 15 years of experience, and Ann and her staff and the 625 volunteer physicians and 8 hospitals and all the other myriad of other participants really deserve our gratitude and applause for stepping up and very quietly but consistently delivering a program to this community that reaps tremendous benefits to the thousands of patients that have been seen, but at the same time for our community as a whole.
As I remember, there were quite a few promising communities that were trying to replicate this. There was some grant money from the Robert Woods Johnson Foundation. And at the end of all that, only a few of those that tried to replicate really have had a long-term relationship with the community and lasted the 15 years since the inception. Am I correct on that?
You are. And I think it's a tribute to the sense of collaboration and leadership and coordination that key people across this community have stepped up to deliver. And it has stood the test of time. And it's a proven program now in our community that's a very important integral part of our community.
As we talk about this, Ann made a very important point that many of these people are working folks. They just can't, they may work 2 or 3 jobs, aren't availed of insurance through their workplace. And I had someone, because I've written an article recently asking me about, well, the Affordable Care Act covers everybody. But that's not particularly the case, is it, Ann?
No, I think a lot of people in Kansas remain uninsured, and there are a couple of reasons why. There was an expectation when the Affordable Care Act was passed that people at a particular income level and below, under 125% or so of federal poverty level, would be qualifying for expanded Medicaid. And then the Supreme Court decided to have the states make that decision. So 26 states, including Kansas, did not expand Medicaid. So we have a pretty significant population of people at very low income who qualify for nothing. Not expanded Medicaid because it's not here in Kansas, nor do they qualify for the subsidies that are available for some people at slightly higher incomes. Then you have to look at the plans that are available in Kansas that you can purchase with subsidies or tax credits through the marketplace, and the co-pays and out-of-pocket expenses, and sometimes between the premium and the out-of-pocket expenses, it becomes unaffordable for a lot of people. So they remain uninsured as well.
Well, uninsured put a real strain on parts of our community, John. I know when we went through the Health Access Project and we talked about that, hospitals are under extreme pressure through their emergency rooms if our uninsured population stays high.
Right.
Is that correct?
It is. And I think in Kansas, the hospitals are particularly keen about this issue and the decision to not expand Medicaid, because they have consequently lost some of the federal support that have historically gone to help support the uninsured. But the lack of expansion of Medicaid has not allowed other patients that would have otherwise qualified to come through their doors and obtain care covered by one of the various insurance products.
Well, that becomes very expensive. I think we've all known from those days when we had our health assemblies that uncompensated care and through the hospitals is very expensive. And we call it uncompensated, but somebody ends up paying the ticket for it.
Yeah, and I think that cost is spread across the community. And it could be argued that our community may be paying a little bit higher premiums for insurance, healthcare insurance premiums, because of that cost of uncompensated care that is delivered in our community. It's a complex issue, but I think it really deserves close attention. It deserves study, and I think policymakers are in a unique position in Kansas to really look at this issue carefully and see if there isn't some fiscally responsible way to be able to address this concern.
Until then, though, we're blessed that we have Project Access that kind of stands in the gateway for those folks and gives them alternatives for their health care.
I think another benefit of the program is it does save the community money in the long run. We identify people early in their disease states. They have much lower readmission rates in the hospital. Project Access patients do. They are much less likely to use the emergency departments for primary care needs. So we're getting them sooner, getting them healthy before more serious consequences come from those decisions, particularly people with chronic conditions.
Over the years, Sedgwick County and the city has helped out by putting some marginal money in to running the organization, but also purchasing pharmaceuticals. And I think we know that you can treat someone and diagnose and have them at a primary care physician, but if you don't get them on the right meds or take care of their issue, chronic issues, diabetes or whatever, it only exacerbates and gets worse. So that pharmacy money really helps out with your mission.
Makes a big difference. That's the number one question physicians ask when we're trying to recruit them to participate. Is there medication support? Because I can donate my care, but if a patient can't follow the treatment plan, they're going to be just as sick 3 months later.
You know, Commissioner, we might add that for every dollar that's allocated to Project Access for pharmaceutical support, we leverage that for additional donated pharmaceuticals that are being used in the community. And for every dollar, we leverage about 16 additional dollars worth of medicines that are now available in the community. Ann has people on her staff that are proficient at being able to negotiate programs and opportunities with pharmaceutical companies to be able to deliver medicines at the right place at the right time. And without that support from the city and the county and United Way, we just simply wouldn't have that available to our community.
We also know that good health can be a good oral health too. So you have dental operatives that help out with that, because many times the general health condition of someone that has rotten teeth and it hadn't been taken care of and has gum disease really overwhelms them with other physical problems.
We do have dentists that participate, and sometimes cardiologists will call our office and ask for a patient to see a dentist to get that taken care of before they do heart surgery. That's very, very important.
Well, I think dental health is very important with anybody that's got high blood pressure, heart conditions, or anything like that, because they kind of feed off each other. One of them's not good for the other.
They're closely related.
Yeah. Well, I think everything with healthcare in your body is closely related.
Yes.
I think
Absolutely.
it's
a
all
whole
linked
person.
together. So, well, as we finish up today, I thank you for coming and talking a little bit about Project Access. I know you know that I'm very supportive of your mission and what you're trying to do. It's good for our community. It really stands in the gateway for those folks that have a struggle taking care of their physical health, but it makes a huge economic difference in our community. So I'm going to throw it over to both of you. Ann, last words, and John, last words before we leave today.
Well, first of all, thank you for the opportunity to tell the story, but I would ask any of your listeners to call our office at 688-0600 if you have any questions, if you think we might be able to help you too.
Commissioner, I would echo Ann's thanks and extend that warm and heartfelt thank you to not only the county, but also the city and United Way and the many other participants in Project Access. Project Access sets this community apart from many other communities around the country. And it's the envy of many communities. And we're very, very cognizant of that and very thankful for the support that many different individuals and organizations provide. And we pledge to continue to deliver a quality program and work very hard for the citizens.
Well, that's great. Well, we're done for today, but I did want to make the point that Project Access has been important to our community. As we embarked on our thought process about health access and what to do at the health department and in our health community many years ago, we were struggling with one federally qualified health center. We now have three and a couple of that are lookalikes. Project Access is in its 15th year serving the community, and we have a much more coordinated, navigable system for those that are uninsured. The population hadn't gone down, and there's still a threat to the economic viability of hospital emergency rooms, particularly in western Kansas. But we're going to continue to let Project Access do what they do. Hopefully the county and the city and United Way will stay supportive. I know the medical community will. Thanks for being with us today. I'm Tim Norton, 2nd District County Commissioner. Thanks for joining me for A Word in Edgewise. See you next time.